The following indirect bonding techniques are adapted from the clinical processes of Dr. Richard P. McLaughlin. These techniques can be used for both metal and ceramic brackets. You will see metal brackets used in making the tray and ceramic brackets used in seating the tray. Make an accurate impression using Chromaclone Ortho. Set time is approximately 45 seconds. Once the model is set, mark the vertical axis of each tooth. Using a Zand gauge for accurate measurement, mark the model with a pencil to indicate bracket placement. Here, the marginal ridge is indicated in red. Refer to the McLaughlin Bracket Placement Guide for maximum precision. Brush a separator solution on the tooth portion of the model and let dry. This will allow the custom base to remove easily. Here, 1 part Alcoat with 3 parts water is used. To create the custom base, start by using Opal Bond or Opal Bond MV. For added bond strength, paint the bracket base first with Opal Seal. CXI and CX ceramic brackets require a layer of Opal Seal on the base, while it is optional to apply Opal Seal to the MX metal brackets. Lightly press the adhesive-coated brackets into the model by aligning them with the markings. The model can be stored in a dark, light-proof box before final adjustments are made. Once final bracket placement is determined, remove flash. Cure directly over the brackets with Velo Ortho in quadrant mode for 2 3-second cycles per tooth. Brackets may also be cured in a triad machine for 8 minutes. This will bond the brackets to the model. Place rope wax on the lingual and facial surfaces of the models, just at or below the gingival margins. This will establish a barrier for the PVS materials used in creating the tray. Express a bead-size amount of Emaluma over the brackets, being sure to include the hooks. Emaluma is a clear PVS impression material with high tear resistance and easy release. Immediately follow Emaluma with placement of a clear, firm silicone. This will blend with the Emaluma and will give the tray a more rigid structure. To structure the tray, wrap the model in a plastic film while the silicone sets up. Recommended width for the first sheet is 25 mm by 250 mm. After surrounding the facial wall of the tray, cover the occlusal surface with a plastic, arch-formed sheet, slightly larger than the tray. Press air bubbles out. When the silicone is set, remove the wax and plastic film from the model. Trim the excess material around the tray with a sharp scalpel. Place the model in water for 20 to 30 minutes to allow the brackets to separate from the stone. Starting with the posterior, remove the tray from the model, ensuring that the brackets remain in the tray. Trim again if necessary, and cure with Velo Ortho on quadrant mode for 1 3-second cycle per tooth. Micro-etch the custom base with 50 micron aluminum oxide to remove model and separator residue while leaving the adhesive intact. Brush with a soft bristle brush to clean additional debris. Rinse and air dry. Mark the midline for accurate placement. Make sure the tray is clean and place in storage until the bonding procedure begins. Clean the patient's teeth with an oil-free pumice. Here, Ultra Pro TX Pure is used, which is also non-flavored and non-fluoridated. Rinse and air dry. Isolate the teeth with cheek retractors to prevent saliva contamination. Etch the entire facial surface of the tooth with Opal etch for 30 seconds, being careful to avoid contact with soft tissue. Rinse and air dry. Etched enamel should appear chalky. Paint a thin layer of Opal seal to the etched enamel. A 2-second gentle blast of air per tooth will ensure an even coating. It is optional to tack cure the Opal seal. Coat the custom base with Opal seal to prepare for bonding. As an optional alternative, you may use Opal bond flow in place of Opal seal. To avoid ambient light curing, do not coat until you are ready to begin the seating of the tray. Remove suction from patient's mouth while keeping the cheek retractors in place. Align the center of the lower tray with the patient's midline for accurate delivery. Press the tray firmly onto the teeth. Hold the tray in place and cure directly over the brackets with Velo Ortho in quadrant mode for 2 3-second cures per tooth. Align the center of the upper tray with the patient's midline for accurate delivery. Press the tray firmly onto the teeth. Hold the tray in place and cure directly over the brackets with Velo Ortho in quadrant mode for 2 3-second cures per tooth. Remove both trays by lifting from the lingual side. Cure once more directly over each bracket with Velo Ortho on quadrant mode for an additional 3 seconds per tooth. The bonded brackets are ready for wire placement. The efficiency of indirect bonding offers accuracy in bracket placement with significantly reduced chair time.